Okay, hi everybody. We're going to get going with my second lecture here for the Southwest Botanical Conference on food addiction. Now, this might be a new concept for a lot of you, this term, but it's not new in terms of your patient population and their struggles with maybe sticking to a nutrition plan or sticking to lifestyle changes and healthy eating, which is healthcare providers we're all, trying to do. The Diagnostic Statistics Manual, the fifth, edition that is out, doesn't define food addiction, which is why some people think, oh, that's a controversial term because it's not in the DSM. But what we do is we take a look at some other similar definitions that the DSM has, like caffeine use disorder. So University of Michigan, they've been studying this as well. And they did a little survey of 384 adults, and 92% reported a persistent desire to eat certain foods. And no, it wasn't broccoli or asparagus. It was the sweets, the salty, the fatty food, despite attempts to stop eating them. And of course, we can't have a naturopathic discussion or a botanical discussion without talking about the gut microbiome, because the gut microbiome is involved in a lot of these neurotransmitters and also hormone balance, which we're going to get to in a minute. But your gut flora, your gut balance is so important. But it actually can change your taste receptors in the mouth. So this is some of this updated 2016 Yale Food Addiction Scale. Updated it by adding in about 35 more very specific questions where there's more psychological symptoms. So let's kind of see, how we can begin some treatments. So this is the pharmacology part of this talk. And so for some of you who don't have prescribing rights in your practice, I still want you to know about these, because you may have, somebody in your patient care who could prescribe these. But this is a little example from some mindfulness studies on chocolate cravings. This was published in 2014. They did a 2-week mindfulness intervention. Awareness, okay, I'm aware of the chocolate craving. Acceptance, okay, I accept this. Disidentifying from it. They kind of compared this to other mindfulness interventions of like distractions.